Okay, we are starting and recording. I am admitting everyone. Hello and good afternoon, everybody, or good evening, I should say. We are starting the meeting, but we have a few people who are still logging in. So as they are being admitted, I'll go through some of the normal items that we do as far as for our going through our usual beginning stages. So for those who do not know me, I am Dominic Zerlo, and I am the Center Director at the New Mexico Department of Health with the Center for Medical Cannabis and Psilocybin. And I'm joined here by a couple of our colleagues, so I'll have them introduce themselves at this point. Jorge, if you would go ahead and introduce yourself.
Good evening, everyone. Thank you for being here and thank you for your contributions. My name is Jorge Gonzalez. I'm the Medical Psilocybin Program Manager.
Okay. Adrian.
Good afternoon. My name is Adrian Estrada. I am a health educator with the Medical Cannabis and Psilocybin program.
Thank you, Adrian. Ishmael.
I apologize there. I'm just fixing my table. Good afternoon. It seems really bright there. Good evening. My name is Ismail Zutad. I'm also one of the health educators here at the Center for Medical Cannabis and Psilocybin. Thank you, everyone, for attending.
Great. Thank you, Ishmael. And Dr. Robert Truckner, if you could just go ahead and introduce yourself.
Hi, everybody. I'm Robert Truckner. I'm the medical director for the Medical Psilocybin and Cannabis programs. I'm thrilled to be here, and I'm interested to hear what y'all say.
Okay. And so that is our team from the Medical Cannabis and Psilocybin program and center. And so just as a reminder for everybody is we do record these meetings. And so since we are recording them, we do ask that everybody be a little cautious with their language. In other words, no profanity. We do have to bleep it out otherwise because these recordings are put on our website. And along with that, that is part of the reason why outside of the team and the board members, we do not actually have cameras on. And the reason for that is just in case there is something in the background. But the secondary reason for that is so that we can ensure that as people are actually that people are able to connect on the internet, because we do know that some areas of the state internet can be a little spotty at times. And so we want to make sure that we are able to have people on as much as possible. And the video just unfortunately causes people to drop off on a regular basis. And so we would much rather have people here, even though you may not be able to see faces, rather than have people not be here. And so I hope that you all understand that. And at this point, I believe DezBaa I don't believe DezBaa is the chair of this committee. And so DezBaa, if you would like to introduce yourself, and then I'll turn it on over to you. Oh, DezBaa, if you're speaking, your mic is still muted. And it looks like DezBaa just dropped and is rejoining. Speaking of internet connectivity, sorry, everyone.
Yeah.
Well, while that's happening, what I will just go ahead and do while DezBaa rejoins is just some of the other housekeeping sort of items, and I'll be putting some of this in the chat as well. But just as a reminder, if you have questions with regard to the program or would like to go to the websites and see them, then they are on these links that I have on the screen at the moment and that I am putting in the chat. If you have questions or you would like to submit written comment after the meeting and would like to do that, then what you would want to do is send it to our email at medical.psilocybin@doh.nm.gov, and I am putting those requirements in the chat as well. Let's see. And DezBaa, have you been able to rejoin?
Dominic, look at for some reason it keeps it just says admitting. I don't know if you see that.
I do see that.
Okay.
So I'm not sure. It looks like DezBaa may be having some connectivity issues, everyone. So with that in mind, what we can go ahead and do at this point, hopefully DezBaa will be able to join us here shortly. But in the meantime, if there are individuals who would like to introduce themselves, if you don't mind putting your hand up, and then we'll go ahead and call on you and be able to have you introduce yourselves. But one more time, it looks like DezBaa may have been able to join. DezBaa, are you here?
Yes, finally.
Perfect, thank you. So DezBaa, if we just went through some of the logistics, so if you want to introduce yourself, and then we just asked if there was anyone else who wanted to introduce themselves to raise their hands. So while DezBaa, while you introduce yourself, anyone else who would like to do so, please raise your hand and we will call on you shortly.
Yes, so I'm DezBaa, and I'm chairing the Equity, Access, and Cultural Considerations meeting. We have had a couple of meetings so far. And I'm here in Santa Fe, New Mexico, for some of you who don't know where I'm at. And yeah, I would definitely love to have more people who are new to introduce yourselves if you would like to. We have gone over a couple of different topics in the past and concerns from the community, and we have come up with a list of some of those things. Right now, the legislation is still in session, so we're going to be hearing more back from that and then being able to move forward from there. So there's just a little bit of a lag time also too for some people who are new. Tribal governance has been in concern to get more of the tribes involved in New Mexico, since we have 23 different distinct tribes here. And we're also sort of waiting on being able, again, with legislation, to be able to go through with allowing the governors to settle in, and they change every year, for those who are not aware. Yeah, so I definitely would like for people to introduce themselves. Let's see. We have, yeah, that'd be great. And then if you have any other quick questions, sorry I was late. I keep thinking that there is like not an issue with either the camera or the links or something, and I had to have someone reboot my computer, and that completely destroyed all my passwords and everything. So that, and all my settings for my camera. So then I didn't realize that had been happening. So yeah, if anybody would be interested in telling me who's here, that'd be great.
Yeah, we have Kate Hawk there with her hand up. Kate, please introduce yourself when ready.
Everybody, I'm Kate Hawk. I'm in Santa Fe, and I've been working with psychedelics and trauma for over 40 years. I've been a MAPS member that whole time. I ran the Native American Trauma Project, and I lived in Arizona on and around the Navajo Nation for all that time, but I'm in Santa Fe now. We host the Santa Fe Psychedelic Society here. And I've done the Colorado Natural Medicine Facilitator licensing and the MAPS MDMA licensing. So I'm really interested in having more access, and especially Native communities here. Thank you.
Thank you very much for that. Next, we have Chavez Fleming. Pardon me if I got that wrong. I've enabled your mic. Please begin when ready, and let me know how one pronounces that. So just to let you know, I've enabled your mic, but you have to unmute yourself. If you're finding any difficulty in that process, there have been instructions posted by our director, Dominic Zerlo, in the chat. If you're still finding difficulties. Yes, we do. Fantastic.
Thanks. My name's Chavez Fleming. I live in Cuesta. I'm Chicano. I've been in New Mexico my whole life. I'm a psychedelic mycologist with over 30 years experience. I published a cultivation manual on psilocybe, the bulk cultivation of psilocybe. I teach magic mushroom classes through the Native Roots School based out of Taos. and I have a rare condition called cluster headache that I treat with psilocybin.
Thank you very much for sharing that. Next, we have Gregory Evans. Gregory, I have enabled your mic. Please unmute yourself when ready and go ahead.
Hi, my name is Gregory Evans. I'm an independent researcher and home mycologist with no affiliations. I am a Santa Fe resident. My intention here is to support the program's development through committee recommendations aligned with emerging research and best practices. As well as that, I'm very glad to see that you made it here, Chevy. And yeah, Kate, it's always good to see you. Good talk last night.
Thank you very much for that.
And DezBaa, thank you so much for hosting this.
Thank you very much for sharing. Next, we have Brett Phelps. Brett, I have enabled your microphone. Please unmute when ready and begin.
Hi, good evening, everybody. This is Brett Phelps here. I am an attorney based out of Las Vegas, New Mexico, and living in Mora, New Mexico. Particularly interested in this committee to see what we can do to provide rural access for all of us people living out in the far reaches of our state. So thanks to DezBaa and Dominic and the rest of the team, everybody working on this.
Thank you very much for that. Next, we have Catherine Warnock. Catherine, I have enabled your microphone. Please unmute yourself and begin when ready.
Hello, everyone. Thank you so much. Especially want to take a moment to thank the board.
I believe we were experiencing some technical issues there. Does anyone, can you hear Catherine?
No, I can't hear.
Okay, you've dropped off there. If you'd like to start again, give it another go. If you're experiencing technical difficulties, sometimes there we go. Hello.
Yeah, I don't know what happened there, so I don't know how far I got, but I'll just say my name is Catherine Warnock. I'm located in Las Cruces. I am a licensed counselor. I'm a huge advocate for the healing properties of this amazing medicine, and I'm here mostly because I want to contribute in any way possible. I do have some experience using this medicine. I'm also, I have a colleague who is currently in Mexico and has connected with Maria Sabina's daughter, and they have asked to be a part of all of this. And I didn't know if that's something that we would be interested or not, but I thought I would pose it to the group. She would require a translator if that's something that everyone's interested in. I know we want a lot of voices from New Mexico, so I wasn't sure if offering this to the group would be something of interest or not, but I very much want to make sure that that is an option if anyone's interested. Thank you very much for being here, everybody.
Thank you very much. Next, we have Meredith. Meredith, I have enabled your microphone. Please begin when ready.
Hi, I am a future practitioner. I guess I'm applying to programs in clinical psychology this fall, and I'm specifically interested in working with justice-impacted folks and hoping to incorporate psychedelic-assisted therapies into my future practice. So really important to have equity and access, and I'm excited to be here and learning. So thank you all.
Thank you very much for that. Finally, we have Zoe Sperlitos. Pardon me if I have pronounced that incorrectly. I have enabled your microphone. You may begin when ready. Again, to unmute, the instructions have been placed in the chat by our director, Dominic Zerlo. If there are any technical difficulties that you may be experiencing, often it may be the case that dropping off the call and joining back in may solve those issues. So may perhaps attempt those if no other solution is found. Whenever you do get the opportunity to speak, just raise your hand again and we can try and get that going. So just received a message in the chat. Zoe says it's happening again. She's in reference to the previous committee meeting. She had microphone issues, I believe, but she will type in the chat. So that will be, we shall await something there. In the meantime, DezBaa, I shall pass it back over to yourself.
Okay. All right. But yeah, so I'm a little limited because I had to log in on my phone to be able to see everybody here. But so yeah, so thank you all for introducing yourselves. And if there's anybody else, I see more people. So far, it has been mostly just kind of a listening session with just trying to get understanding of different people. I would just implore you all to continue to share the links and what's important to you in the rural areas, because what part of this equity access is just to understand the different areas of New Mexico that there is access and what that looks like. What does that look like to everyone? So far, it seems it's been financial needs. We're also looking into, I think, the patient fund, which is also another legislative item that needs to be addressed, and we need to kind of wait for until that is all set and done. We're going to be done with the legislation, I think, February 20th, I believe. And so there's this kind of a little bit of a lag and a waiting period for some of these issues that need to really be resolved. But in the meantime, it's just kind of looking at like what are the different areas of the state really need. At least, and I don't want to be the person to say what needs to be done. I'm looking to really the communities. What has been discussed in the last meeting was the possibility of going out into the communities and doing one-on-one in-person listening sessions in the future. And again, after this legislation is done, that might be something we are looking into. I definitely want to be able to look into it. And then also when we get together with the board, also having conversations with all the other committees, if that's something that's possible. Maybe not all of us can go, but this is something that I'm presenting to the people that are attending here and to talk amongst your other networks. You know, I'm hearing Las Cruces, I'm hearing Taos, I'm hearing Mora, people who are there. Also Espanola area, this is where I'm from. You know, I also have ties to family in Farmington. You know, what does it look like in all these different areas? The needs of people in Roswell are going to be slightly different than those that are in, say, Raton. And this doesn't just go with patients. This also goes with facilitators, administrators, and anyone else who is going to be facilitating this medicine to patients. It also goes to how we are going to proceed with, I guess, divvying up or seeing like who is actually going to be able to, what does equity look like when it comes to the patients in these different areas? Is it going to be just regional? Is it going to be socioeconomic, demographic? And then also, again, the cultural considerations. I don't want to just say the cultural considerations are only specific to Native Americans, but I also don't want to dismiss the fact that there are Native American concerns. I will point this out. I'm not sure how many Native American people that I'm seeing in this particular call. I'm not saying that we all have to be in here in this particular committee, just because I am like the Native American board member that is a part of this. What my main concern is mostly that how does that look like as far as like an indigenous reciprocity? What does it look like when it comes to reaching out into the communities? What is since especially coming from the Native American point of view, the government hasn't always kept up to its promises when it comes to Native Americans and abiding by the treaties and providing the access. So what does that really look like if we are able to provide that not only to Native American communities, but also the rural communities and anywhere else in between? I know I've heard also that cost is also a huge concern, whether it means cultivators, people who are in the propagation, them being able to do the tests. What does that look like? So this is also different intersections of where equity, access, and cultural considerations is really important to understand what that means in terms of propagation, what that means in terms of research, what that means in terms of uh present, like what's being presented, understanding that it's not a one size fits all kind of deal. And then I feel that in some ways that might be what other states may have lacked, or in other terms, in other ways, that's not associated with psilocybin, where we have failed, or where the government essentially has failed. So this is an opportunity to make those rights, to actually turn things around in New Mexico. This is why I really feel like it's important to get out into the actual communities and have these kinds of conversations to really see what's going on. But then that means traveling to, say, the Navajo Nation, or to the border towns, which is Gallup, which is going to Farmington, or what it even means to go into different communities where their belief systems are completely vastly different than, say, what might be here in Santa Fe, for instance. And I think it's really important to find out what those barriers are that may be either psychological, financial, or when it comes to transportation. That's why we're looking into telehealth and what those programs. But I'm really wanting to find out the information from people what's really of a concern. Part of the issue is, though, like I said, is that there are intersections with the other committees that are really important to also take into consideration. I can be on my soapbox all day long and tell you what I feel like is really important to, like, for us to, like, look into, but this is where it comes into having people join the committees and saying, this is what we want to see, and making sure that not only do we say what is important, but then also just realizing that there are a little bit of limitations into how this is being rolled out and what are the restrictions, or considerations, not restrictions, but considerations that need to be understood by the end of the year. I'm not sure if anyone else's feeling has a concern in line with what I've just said. Um, but I know, like I said, we've heard issues of telehealth. What is the telehealth going to look like when it comes to understanding who needs the medicine? What are the, based on the presenting conditions, the committee has the ability to add on to, as far as I know, what those presenting conditions are that are approved by the department, which is, we can make the recommendations to the department. So I'm like a bridge. I'm the bridge, and this committee is the bridge, and the advisory board is the bridge to allow more people to provide more input. But that means we need more input. I'll put this in a different context. If we only have limited input into AI when we're using ChatGPT, we're going to get limited output. So this is where we need the public to really kind of come in. If we're saying that cactuses are only supposed to be green, and we're not taking into consideration that somewhere they're sometimes white or yellow, we're only going to be seeing green cactuses in the output section. Okay. So I really need your help when it comes into saying what programs we need, how we're going to do the education, what your communities need as far as being talked to or listened to, really, essentially is what it is. So I'm hoping that we can kind of figure out how we're going to be going into the communities and providing these, like, what the differences, and it might be in Espanola versus Las Cruces. And I feel like I'm just a broken record at this point. Hopefully, Zoe, maybe did you able to like put something in the chat that you wanted to share? Oh, okay, we did. Okay, let's see. I'll go ahead and read what Zoe said if Jorge and Dominic don't mind. My name is Zoe, and I'm going to mess this up, Spryralatos, and I am a psych nurse practitioner and professor in Buffalo, New York. Bird and snow. Oh, no. Geez, I know what that's like. I used to live on the East Coast for a while. I was invited by a colleague who teaches in New Mexico, and I was interested because this is my area of research, and I'd like to bring into practice. I am very familiar with the topic of equity, access, and cultural considerations. I can give more detail on that a different time, but wanted to at least say hello and thank you for having me. Okay. I have been trying to write down and keep track of like who's been in the meetings just on my own. And I'm not sure if we have heard from Zoe before. I know that there was someone who was also in, no, I don't think we have. I think that person was also a lawyer. But yes, glad to have you here, Zoe, and definitely want to be able to have more input on research-based equity, access, and considerations. Oh, this is your first time. Okay, great. First time caller. Yay. Hi, thank you for being here. It's unfortunate. Keep trying with your microphone. I don't know if we can try again because it would be great to just have you provide more input based on what you have to offer. Okay. Historical reckoning, wholeness, and yes. Yeah. So, I mean, another part of that is, and this is on my phone. Just bear with me. I'm so sorry that I'm actually really not this technically inept, although it is apparent that I am at this point right now. I generally am not. My dad and my parents always asking me for help, and it just, I'm going to blame Microsoft. I will say that on record. I'm I'm just not familiar with it as much as I would like to be. But yeah, it kind of just goes back to, you know, there's the governance part, right? I'm going to try to see if I can break this up into several different sections as well. There's the governance part. There's government, and I want to just point that out. Yes, we are part of, I'm a liaison with this. This is kind of basically where I feel like I'm always in between. They have it, I'm going to use this phrase in a different way, ni de aquí, de allá. It's like I'm neither here nor there. And I kind of feel that in a sense, like not only culturally, because my mom is you know, she was from Mexico. And then my father is Native American. And then I grew up in northern New Mexico, which is predominantly Hispanic, Spanish speaking culture there. And I did not grow up on the reservation. So there's a lot of code switching that I feel like is important that we also understand, where there's the government and, like I said, historical facts, what has done in the past, and that there is this natural medicine, as Catherine had pointed out, Maria Sabina. We all are aware of the historical context of psychedelic mushrooms. But there has been this medicine, there is this medicine. And, you know, but what does it look like to make sure and maintain now in this context of the state of New Mexico as a part of the United States of America? What does it look like when we have a responsibility to establish care and provide, you know, like working with and also against itself, where this quote human right, I feel, is taken away in some ways. And why was it taken away? Because brown people had medicine, and that was not a good thing. Government take it away, and now we have to work backwards, I feel, in this context of like, what do we do now? Whereas it might be great to sit there and just say, let's take this away. We are under these constraints and these limitations and these restrictions that are in place. And until they are lifted, we have this work to do to have a responsibility to allow within these constraints public and the people who really need to have access to this medicine. It may seem, for all intents and purposes, that it seems backwards, and I totally get you and I understand that. I'm just kind of giving my soapbox. This is only coming from me in my personal capacity, but that's where, like, in the capacity as a part of the board, where do those two things intersect, and how do we meet the need, as well as also trying to move ahead as a society to a place that is more whole, right? And that's where I'm trying to get back to the soapbox thing. When it comes to indigenous wisdom and spirituality, that is, we cannot dismiss from the medicine, is there's this idea of trying to regulate this medicine, and I get it's kind of really just all out there, but how do we give back? And I feel like that's part of where this equity, access, and cultural considerations really kind of starts being a place where we go into the communities and understand what is needed there, and if and allowing them the agency to have the choice of doing so, that it's there if they need it, and what are we going to do and implement, and what are those recommendations that the community has. It's not up to us to go do it, but the department will be the ones to figure out how to do it, and we can only say this is the best way that we feel is possible to do so, and these are our recommendations to the department to provide that. And again, that's why it's saying, it's going out into the community. For the longest time, that we have people saying that this is how you're supposed to give birth, or this is how you're supposed to be done. And we all know it may or may not be true. The recommendations are you do such and such a things to be able to take care of people. But this is where we have an opportunity to do better. And that's why I'm saying it, like, it falls on the rest of us. So it's about possible, like, apprenticeship, having the reciprocity, being responsible with our as a committee, as a board, to make these recommendations. But it's also part of the community's responsibility to speak up, right? That's kind of also where I'm getting at, speaking up and, like, saying we have a fear, or we have a concern, or this is the thing that we feel like has happened before in the past, or we're ready for it, when are you going to roll it out, or we have so and so number of people, but we have this need that needs to be met in order for it to happen. But we also need to, these are some questions that I had thought of, or I didn't think of them, but these questions that came to me, is, what is our relationship to the community, and how can the board be able to provide that equity, access, and those considerations? Like I said, there's going to be a different region in the Northwest area than there is going to be in the Southeast area of New Mexico. It's different than the cities are going to look, and what needs to happen there. And then also too, like, we can't just kind of go and say that this is beneficial medicine and tell people you need to have this, right? It needs to be coming from a place that there's a conversation and there's a dialogue with the community and what they really need, and saying, hey, and that's where the education comes. I feel like this is a lot of the education. All right, I'm going to see if there's anybody that's wanting to talk at this point, because like I said, I'm on my phone. No. Okay. Yeah, so in the meantime, I do have different, been working with trying to get a set of definitions. So I've asked for the help of the department to kind of get through what needs to be taken care of, but also just realizing that there are recommendations that we can provide. But we do have a duty as the chair to provide what does let's see, like I said, trying to meet the restrictions and trying to meet the concerns and trying to meet the scope of what the board is establishing as recommendations to the department. And so there's responsibilities that we have on this part of providing these recommendations, and also understanding that New Mexico is different than Colorado, New Mexico is different than Oregon, but also understanding that maybe some of the information that we have, say from New York or Oregon or Colorado or any of the other places that they're doing either research or clinical trials, may have kind of come across as far as like what's important, and other research areas that may or may not have happened. So I do need that input from people. I don't know if Zoe has tried again to see if she can get her microphone to work. And I don't know, Dominic, if you had something that you wanted to say or not.
Yeah, I would just say something that would be really helpful would actually be to talk about what sort of requirements there would be with regard to the equity fund, and ensuring that we get it out to people other than income. And the reason I say that is because income is the easy one. You know, we could set up a system, for example, of who would be eligible for the equity fund based on, you know, for example, are they at 200 or 300% of poverty level or a percentage of that? But the areas that we really need to know, and that really I think are going to be important to ensure that there is that access and equity with regard to that fund, and being able to help pay for whether it be treatments or transportation, you know, interpreters, as Catherine kind of brought up earlier, you know, how exactly we do that through the equity fund. What are those other areas? What areas do we need to focus on? And it's easy to kind of say, oh, well, rural and frontier areas. But what exactly does that really mean in this context? Like, what are the parameters for that? And how do we do that? And so what would be helpful for us is to have recommendations on, and not necessarily right now, like the exact aspect of, like, you know, saying, well, we consider rural to be so many people within so many square miles. We don't need that part, but what areas do we need to focus on? What are some of those populations that are going to have the need for it, whether it be, you know, how do we define that, you know, that marginalization, or, you know, that lack of services? How do we do that? That's what we really would be helpful for us.
Yeah, and I'm thankful that you're bringing that up, because I feel like, yeah, I honestly, and I will say this, I don't know, right? For me, in my perspective, I don't know, because I'm here in Santa Fe. I'm in some ways siloed from what the needs are, even in Espanola, or, you know, like where I'm from. I'm not on the ground there to have that input from the people that are working with the populations that need it. All I know is that I'm happy that they have a blue bus, the RTD, the Rio Riba, you know, that's going there. But how reliable is that? And, you know, what does that look like? That thing does not run all the time, and it doesn't run. How far does it run? You know, how slow is that system? And is that only for, you know, the Rio Grande, the Rio Riba? What does that look like? And even, I mean, I used to live in Boston, I used to live in New York, and our public transit system, even though we complained about it breaking down all the time, was still more reliable than what we have here in New Mexico. And that is a very important aspect to consider. Again, what's happening in Farmington is going to be very different than what's happening in Roswell. And I do need the input from people in those specific places in order to understand like what that looks like for them specifically. And as far as, you know, there is, I'm probably going to use this wrong, but the correlation of between the opioid overdoses that have risen in Rio Riba, Santa Fe County, and I believe Taos over the last like year, or the beginning of last year, or the beginning of the 2 years ago, now that we're in a new year. Those issues and those instances are important to understand. Domestic violence is also important to understand. PTSD, like all the different conditions that are really important. When it looks like, you know, you have urban natives like myself in Santa Fe, what does that look like? Am I going to be able, is something going to happen between the Santa Fe Indian Health Services or even having like a liaison between there and, Medicaid, or, what are the pathways that that's going to look like. And this is where I seriously need the input from people in these specific places. And I totally understand that, like, right now, at least this is my understanding, that we're all super happy that this is happening. And so our effort, and maybe our mind, some of us, not everybody, that's why some of you are here, is really going into, how do we grow this? How do we get this happen? How do I get in on this? How do I make this happen so that I can benefit from it, right? But then this is where, to me, this is where the cultural considerations and the indigenous wisdom go into play. But what about the people at the other end that we're actually trying to be able to help with this, right? Is, yes, it might be great to get in and have a lucrative business, and, finally we get to have this going. But the people at the end of that chain of events is the whole point of why we're doing this. Is the whole point is to bring back wholeness. Is the whole point is to be able to go back into our communities and help the people that need it most.
DezBaa, I just wanted to quickly say that there was someone in the chat who has dropped a line. UW Milwaukee and the state of WI, which I'm not familiar with because I'm not from the US. I'm assuming that's Wisconsin. Maybe no one correct me on that. I don't know. Had grant monies to utilize for SUD/AODA programs in indigenous communities instead of those state institutions administrating grant monies. They turned it over to 4 nations in the state to create their own programs to serve their communities closest to home in the most culturally aligned means possible.
Okay, I like that. If we can make sure to take that as a note as far as the future discussions. Is there any follow-up with that, with what, and then that kind of goes into, yeah, I mean, that's a great point of example, for, allowing a community to be able to provide. And I'm not sure what the responsibility of New Mexico is too, but this is grant money. So we had grant monies to utilize for, I'm not familiar with SUD. Can we spell that out if you don't mind? AODA.
DezBaa, that's substance use disorder.
Oh, okay. Sorry. I'm not familiar with.
No, not a problem.
Okay. And then the AODA, alcohol, I'm assuming.
That one I actually don't know. We don't utilize that here very much. Let me see if I can find out.
Acronym meaning, let's see. Accessibility for Ontarians and disabilities. Is that accessibility? Ontario, that does not say alcohol and other drug abuse. Okay.
Oh,
Is
there
that
we go.
okay?
Yep, that makes sense.
All right. In the indigenous community, instead of those state institutions administering grant monies, they turned it over to 4 nations in the state to create their own programs to serve their communities closest to home. Okay. No, that sounds like it would be a good suggestion to look into how that can be utilized for Native communities. That's another good one. But also, again, back to this idea of, so that I said, sorry. The acronym AODA made me think about ADA, which was Catherine's thing as far as translators, but I was also thinking accessibility in terms of other accessibility for other people who need that. And that is also another important thing for me as far as accessibility, access, what that really looks like. But yeah, like I said, I just could be on my soapbox, but I really just need the input from other people to say, these are the things that we need to look at and to talk about. And it's not necessarily, it is both the responsibility of the Department of Health to provide these things, but it can only go, to me, at least this is my understanding, part of the reason that we're doing it in this particular fashion is so that we don't actually have this paternalistic look at what these communities need, right? And I kind of go back into this idea of my geology, when I was working for the Navajo Nation. They would say that the remediation that needed to happen on Navajo Nation was X, Y, and Z that was based out of Philadelphia, that was based out of New York, that was based out of New Jersey. You can't, those are coastal areas, and that landscape is completely different than what looks like in Navajo Nation. And you can't sit there and say that this recommendation that you have for these coastal communities and the East Coast is going to be able to be implemented based on those metrics in Navajo Nation. It's not going to happen. You need to be able to land-based, again, back to this, as everyone is talking about ancestral wisdom, indigenous and cultural wisdom. But that means that these people actually need to be here to be present to talk about it also as well. But then we also have to have the accessibility, which again goes back to this idea of going out into the communities. That's so important. But then also having everybody word of mouth saying that this is really important, that needs to be. Otherwise, we can only base it on the people who are participating and wanting to be, have that part, be having a seat at the table. And then also having the advocates for those who may not be able to provide that, right? Someone brought up incarcerated persons. And they really cannot necessarily speak for themselves at this point. They need an advocate to say that this is the thing that needed to happen. But even that, it needs to be considered, right? Whether or not this is something that we have the capacity for. And the funding that we have that will come into place needs to be allocated, divvied up and provided, and how, right? And this is just a point that Dominic was making. I'll get to the comment in just a second. But as far as how that's going to look, right? Who's actually going to be able to get that, and for what, right? And these are the things that I feel like this is another completely different analogy, just for the sake of explaining some things. We have like a couple of major cities in New Mexico. Albuquerque's the biggest, I think, and then I'm forgive me for saying this, but then we have Las Cruces, and then we have Santa Fe, and then we also have, I think, Farmington, Gallup maybe, but there's some of these bigger. But the three main, Las Cruces, Santa Fe. As far as the film industry, they're considering Las Cruces like a rural area, okay? But even though it's like a city, but because it's so far down south, it's considered rural. But the population might be bigger. And this is where it kind of gets a little bit tricky when it comes to how to divvy things up and what the rules and regulations are about who gets what. So when it comes to Santa Fe and Albuquerque, we're like the two bigger cities when it comes to filmmaking. And so they say, oh, we don't need to help Santa Fe and Albuquerque. We need to help Las Cruces. But you think about it, they're all kind of sort of in these bigger city categories, and they may not necessarily be, to me, Las Cruces doesn't seem like it's that rural. To me, it's like a city, but in the case of the definitions for the film industry, they consider it rural, right? That analogy is the only reason why I'm saying, like, this is really important to have these conversations about who gets what and what those presentations, what that looks like to be considered for the allocating of the money, who gets. Exactly. Okay. So this is, I'm hoping that I'm glad this is, I know this is getting a little off topic, but it's just for the point of illustration that we, like, people may not understand that that's considered rural in some aspects, and it's not. It's a huge city. All right, I'm going to go to the comment. If you don't mind, I'll go ahead and read it out. This might sound naive, so I apologize. How can we get the tribes and nations in New Mexico to come to the table? The representatives. So this is kind of a little, I touched on this. I touched on this a little bit in the beginning of the meeting, I just blurted it out. We are still kind of waiting on the legislation to die down because all of the tribal governors and everyone else is really concerned about what's going on in the state of New Mexico. And until they can kind of go back into their communities and tribes, and then we can have like a formal sit down with them, that's not going to be able to move forward just yet. So we are working on it. Department is working on it, to be able to have that kind of more formal sit down and talking to. In the meantime, from the comment, death doulas and so forth, there is a huge network of people, and I'm just not sure exactly how to kind of get more people to either come to the meetings or to provide input through the email, which is on the screensaver that Dominic pointed out earlier in the meeting, to have a written comment. I'm just going to say this, and hopefully maybe someone can be like, no, that's not the case. I have a feeling that there's might be still a little bit of the fear of outing oneself. There's still the possibility of repercussions. And that's in part of the reason I provided myself in this way, to be able to speak for what's needing to needs to happen here, right?
DezBaa, just a quick one. I think there's a hand up in the chat.
Oh, sure, great.
I think it's
Yeah.
Dominic. I think it's your hand.
It's-
Oh, there you go.
Oh.
It's just me. I just was waiting. It wasn't, I just really wanted to give you an update and give everybody a little bit of an update. Is I was speaking with our tribal liaison during the public health day at the Roundhouse this last week. And one of the things we were talking about was exactly this issue and how to do that. And they are going to continue to reach out to the various tribal and Pueblo governments. But what they are doing is they are arranging, and I believe it's going to be in March. They haven't set a date yet, but they are arranging a day where they are inviting all of the Native American governments in New Mexico to a day where they're going to discuss different health topics, access issues. And we are going to have a block of time during there specifically for psilocybin. And what that'll do is it actually helps with regard to some of the issues you were just bringing up, DezBaa, talking as far as outing someone and doing that, because by doing this and including it in an entire day that's talking about various health issues, we'll be able to get, I think, better participation than just if we were doing it standalone. Now, that doesn't mean that we're not going to continue doing other outreach and other invitations, things like that, but just to let you all know, one of the things that is currently in planning.
Thank you for that update. Yeah, I mean, it's prior to getting a part of the board, and also just there's concerns with insurance. There's concerns with how is this going to work, and or with Medicaid, how is it with everything that's going on. I feel like there is definitely more of a need to have this available to the general public. There's a concern that, should we even have regulation in this? Should we just kind of throw that all out the window? Where that may be a great solution in some other alternate universe, the way that we're working right now is in this constraint of how are we going to roll out this particular medical psilocybin provided to certain groups of people and others that we are trying to establish, that we recommend to the Department of Health, that are recommended to the Department of Health. I'll say that again, other conditions that are recommended to the Department of Health, to be able to then have that and potentially for the future use in New Mexico. We are in a particular places that now we have, I think, New Jersey on board, and they're doing their thing, which is great. I applaud all the efforts of all the different ways in which we're doing it. We have the government saying we need to have more studies on this. We have Arizona working on their own studies. New York, I think, is still working on a lot of research and clinical studies as well.
DezBaa, I believe
Yes,
we also have a hand up by Dan Hewson. So
Dan Houston, yes, please speak.
I just have more, I guess, questions or things I've noticed. I'm Daniel Houston, Oregon, Rose City Laboratories. I've been testing in the industry now 3+ years or whatever it's been. And I've seen indigenous or tribal affiliate people talk and come and talk about equity and access and all of that from day one. And some of these different trade shows and stuff that I go to in the psychedelic industry, you know, it's very much equity and access. But here in Oregon, I would have to actually do a little bit more research, but I'm just off the top of my head, it doesn't feel like they've gotten involved with the system. A lot of it has to do with, in my opinion, expenses and all of that. Plus, I feel that indigenous tribal people want to be able to continue to do their rituals in the way they want to consume it. And I feel like Oregon, for sure, has not written it in a fashion that would allow that to happen. So it feels like you've got to tailor it towards how the indigenous want to do their rituals or ceremonies, or allow them some flexibility. And barrier of entry really is cost and stuff like that. So I don't know. Maybe it was a question or maybe it was a comment. I don't know. But anyway, that's kind of my 2 cents.
No, I appreciate your comment on that, and I will say that I have heard, essentially something similar, from people here in this area, and just in general. It does kind of get into like a little bit of a sticky topic, and maybe it's okay that I go ahead and say this, and anyone can go ahead and counter me, and that's totally fine. I can take it. And definitely, this is a place to learn. That's another thing. This is about listening. I mean, we can all, and I'm not saying this specific to you, I'm talking about myself. We can all say stupid comments, and then it just be like, no, we can be educated and being open to listen. But essentially, I feel like that is partially, I'm trying to also wrap my head around like, what does that look like? And I feel like a little bit kind of left out from my native people out there, to say, what needs to happen. And I don't want to speak for anybody either. That
Yes.
and so you're right. It needs to be something that, what does that look like? What is the place in which the Department of Health and/or/New Mexico, and this is probably more like a legal thing, right? But maybe this is where we can say like a recommendation to the department. We can go ahead and say to the department, we recommend that the tribes be able to allow for themselves, X, Y, and Z, right? And that's just throwing this out there, not saying that this is the thing. But this is kind of where we're looking at. What does each tribe and/or generally tribes feel like they need to be able to, and how much leeway, because we don't also want to, not necessarily this is the right term, but entrapment, as far as like not allowing and then allowing. Anyone who's interested in looking back into the federal codes with the Navajo Nation and/or anywhere else when it comes to peyote, which is not discussed here in psilocybin, medical psilocybin, but the use of peyote in traditional ceremonies was both illegal at some point, from the federal government. Then, of course, we have like indigenous tribes not being able to practice their religions. That was given back to them. Then it was also given to the Navajo Nation to decide what they wanted to do, but I think they still tended to adopt the federal government illegality of it, and so forth, right? That kind of gets into this whole sticky situation. But what are the recommendations from the committee to the department when it comes to Native nations being able to decide for themselves how they will use this, and or this is just my 2 cents, if there is any kind of training programs or education or outreach as a liaison from the department that might need to be able to assist establishing that kind of infrastructure or facility or training program to natives that might need it. I don't know what that looks like. And I say this again with the analogy of working for the Navajo Nation as a geologist. When it came to reclaiming the land after coal and Peabody coal extraction from the Navajo Nation needed to have the federal government, still needs, as far as I know, needs the federal government to come in from Denver to come in and decide if that land is being remediated appropriately to give back to the Navajo Nation. So they would be the intermediaries between people company and saying, yes, you are doing X, Y, and Z right. The grass looks green. There's no rifts or valleys or anything. You're good to go. But this takes decades and still probably not done yet, right? So there's the federal government coming in from Denver, helping the Navajo Nation to remediate the land back to itself from the coal company, right? What Navajo Nation was trying to do at one point was saying, we don't need the federal government to do that. We can do that on our own. But they had to show that they could do this, right? And show that they had the infrastructure, the training, the people, the manpower to be able to do what was being done. It's very complicated, it's very legal, but this is what I'm saying is like, what are the recommendations that we have? I'm trying to say is I don't want to say that the tribes can do whatever they want, which is essentially what I feel like could be happening, right? And to the point that the person made about the monies and the grants, yes, they can do whatever they want. But I also feel like because the tribes are here in New Mexico, then maybe we might need to provide some kind of sourdough starter I always use analogies, I'm sorry, to be able to say, hey, these are the things that we have available to you to be able to provide your own training and your own in your community if you would like our help. I feel like that to me is being responsible and not just hanging the tribes out to dry to fend for themselves, but to do as they wish, and it's available if they want it. And I feel in some ways similar that can be also working for other communities. Maybe let's just say Roswell doesn't want to have anything to do with it, despite our better judgment or anyone else is saying, or just any other city, right? This city it needs it so badly. Let's just go back to Espanola. This city needs it so badly, and there's all these crises that are going on. That's a very paternalistic point of view to say that this particular place needs it, right? It's a different thing to say, hey, we have this thing and it would be really helpful. We have this training. If you want it, we have this. It's shown, blah, 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 blah. What does that look like? We have vouchers. We have an equity fund. We have, this thing to help out with the Northern Indian Pueblos Council if they need it. We've reached out to them. They're on board. These are the places that you can go to. Offering a possibility and the pathway is, to me, what that access looks like. I'm not saying that like my idea is great, but it needs to be input from that particular community. And so that's why I'm saying I'm not afraid of saying something stupid that may not necessarily be the right thing, but then that gets us to the thing that might actually need to be talked about. And maybe saying the wrong thing or the stupid thing might then help that community or whatever it is to say, well, you're not quite right, but it touched a nerve and it made me think about what we really need. I'm having these conversations with my kid right now. I say, what about this? No. What about this? No. What about this? No. And it's really annoying for both of us that I'm saying the wrong things. But at some point, we might actually get to the right thing that needs to happen. It's a process of elimination. And I feel like that's part of what this board is doing, is being responsible to the citizens of like, what can we do? What needs to be done in consideration, not just for the tribes, But maybe the framework that we provide to the tribes might actually be able to work for other communities as well, in terms of here's what we have to offer. If you need, to Catherine's point, if you need a sign interpreter for this, if you need a translator, if you need like visual, like what is it that these particular communities need? And what does each one of them look like? It may not be able to be completely hand tailored to each community because that might be cost prohibitive. And, you know, it just, but what would it look like to move in that direction? So that in essentially, it really is the full definition of equity, that everyone who needs it and how they need it is able to have access to it eventually in the future. I don't know. Is anyone else has anything else to say or comment? I would definitely see there's someone's hand up. Zoe, did you want to try again?
Yes, is it working this time? Okay.
Yes.
Okay, great. I really, enjoyed listening to you talk, and you really touched on a lot of great points. And I love how you talked about bringing it to them, in a way, where you kind of mentioned maybe just giving them the option to, if you want it, it's here, because I do think, in a lot of, more of the rural communities and tribal areas, I'm familiar because I do have family that lives in New Mexico. I didn't write that in the thing because it would have been too long. And I have some family that lives in like Jemez Pueblo and, Albuquerque, and then they work in Santa Fe. So it's kind of like there's a lot of gap area. And a lot of things can be very far. So if somebody needs like a hospital or anything like that, and I don't know how you guys do things, of course. So, I like that you mentioned, like, okay, here's the option that we have, but also, maybe going to the communities. I know, you guys are already in the process of doing that and have your, because from what I just heard, have your meetings and things like that. But also, I know in a lot of areas, like I can just tell you from like my area in Buffalo, I work in, of course, and I work in an urban area, but there's not a lot of access to care in some of these areas. So we go to them. I don't do this anymore, but I worked for a few years on an acute community treatment team where we went to people. And I was just thinking maybe that's something that, eventually when this is all put together, of having people go there, maybe having, I'm, of course, my first thought, being a nurse practitioner, are nurses and social workers and people that can maybe get trained and who are more familiar with working with, larger populations and not afraid to go out into the community. Those are just some thoughts I was having because I was thinking about the transportation issues. When you mentioned transportation, I know it can be far, like it could be an hour away to go to get somewhere. And not everyone has that access. So so I think you brought up some amazing points. So I hope that I can continue coming to these so I can maybe build on that too and just think, hopefully with you. But I just wanted to kind of comment on that. And I also wanted to test out to see if I could even comment anymore. But I think I figured it out. I got it. Thank you.
Thank you.
And DezBaa, we just have a couple of minutes left, and we are going to have to close at time.
Yep.
But I just wanted to bring up, we need to do two things. We need to set the date for the next meeting. And I would like to recommend that at the next meeting, we actually create a list of what are those specific items that we need to look at regarding equity and access, and actually start naming them and starting to look at potentially some plans for how to address them. And so I would recommend that for the next meeting.
Yep. I hadn't looked at, let's see, we got 3 minutes now.
And as far as calendar, what I would recommend is we have been asking the committees to hold off until after the session. But a part of that is then after the session, we have that next 2 weeks has actually gotten really busy with various other meetings. So I would recommend if you wanted to stick with the evening time, Wednesday, March 11th at the same time, starting at 5:15.
Okay, I think that works. That works. And then just I will, I feel like don't want to miss people who are, I will try to see if I can, and I know that you guys will work with me on this, but I do want to make sure that we do like a morning and an evening at some point too as well. But next meeting, Wednesday, March 11th, 5:15 sounds good.
I mean, we'd be open if you wanted to do that one as a day one, and maybe do
Okay.
that one in the afternoon, starting at 1 o'clock.
That sounds
And
good.
go-
We'll do that.
So then Wednesday, March 11th at 1 p.m., starting at 1. Okay,
Yes.
we will get that scheduled then.
Okay,
Great.
sounds good. Yeah. And then we'll definitely have more specifics about what to do. And thank you, for reminding me about the session. We need to get these things out. I just didn't want to kind of leave people out and thinking, that nothing is getting done about the equity fund or the tribes. It's just it takes some time to get everyone else on board and on the same page. But if any of you can please just like, in your own networks, all your friends, um, even if it is to kind of light some fires under some people, be like, did you hear what they said? Can't believe they said that. You need to come to the meeting. Just because we really do need to hear perspective. And to me, like, honestly, I have learned so much just by listening to people. But that means that people need to speak up as well. And if there's some way we can have that happen, where we can get more people to speak up, this is incredibly and vitally important to the health of our community, our mental health from everyone, your brothers and your sisters. Everyone is your brother and your sister. I hope you all have a good night. Thank you so much for this. Thank you, Dominic and Jorge and Ismail. Appreciate your time. Appreciate everyone's time. Have a great night.
Thank you to everyone.
Thank you.